CareBridge is our integration engine. It allows us to connect disparate systems, bringing data together to serve inpatient care. The promise of digital health was to make things easier for clinical workflows. But as we started to silo data and put them in different systems, it really didn't serve that purpose. So bringing all that data together, making it available at the time of patient care is really critical in the process. And that's what CareBridge does. It allows us to bring system data together, put it in front of the clinical workflow when it's needed, and empower patient decision-making. CareBridge is vendor agnostic. It allows us to address interoperability barriers with different vendors by providing standards-based integrations. So all of the common healthcare standards and the new FHIR-based standards, new API technology that's being absorbed into healthcare, CareBridge supports all of that. So whether I want to stand up an API of my own, I want to connect to a vendor's API, I want to do things with old HL7 2.x messages, we can support all of it and make those connections so that you can bring that data together. So one of the barriers to building integrations is the technical complexity in doing so. Dealing with these disparate data types, translations, enrichment that needs to occur. Often organizations are resource strapped. They're unable to provide the number of resources that are necessary to build all the integrations that they want. And so with our new release of CareBridge, we've introduced an AI agent to help you with that process. So the AI agent allows you to query the system with natural language, and it can build complex SQL queries, different scripting to achieve complex solutions with simple natural language queries that most of your team can do on their own without having that detailed expertise. We're very excited about the solution. We think it'll make interface builds into minutes from hours and simplify the entire process. So as you're dealing with multiple different systems, understanding data structures, being able to know where data resides is a complex process. What the CareBridge AI does is it allows the AI to interact with the data model and learn that for you. So you don't have to know all that going in. You can ask simple questions like, give me a list of patient medications, and the AI will work with the data model to determine where that data resides. It'll then give you back a complex query that will return that information for you. It makes the job a lot easier. It makes the technical hurdles required to do the integration easier, and it makes your team more efficient. So there's a lot of buzz about AI, a lot of promises, and people are starting to see some benefit from it. With CareBridge, we wanted to make AI useful right away. So we focused on what can we do with AI that would really benefit the end user, and that's making complex things easier. So with CareBridge now, you can query with natural language, ask the AI to do things that you want the integration to do, and then the AI will build the scripts and the SQL that's necessary to be able to accomplish that.